Glendora Seale is the nursing officer of the Medical Directorate of the Queen Elizabeth Hospital. She is one of numerous healthcare providers on the front line of the fight to manage and control the COVID-19 pandemic in Barbados. She takes a few moments out of her grueling schedule to chat with Carol Roberts via Skype.
Good afternoon, and today we're going to have a chat with Glendora Seale. Glendora Seale is the nursing officer of the Medical Directorate of the Queen Elizabeth Hospital. What is that? What does she do normally? And what is she doing at the front lines of the fight to control and contain the COVID-19? We're going to find out right now. Good afternoon, Glendora Seale.
Good afternoon, Carol. Thank you for having me on the program today.
Thank you so much for taking time out of what I know must be an extremely busy schedule to chat with us. I want to start off by asking you, what were you doing before COVID-19? What were your duties at the Queen Elizabeth Hospital prior to COVID-19?
Yeah, prior to COVID, I was functioning in the capacity of a nursing officer, working in a unit that looked after patients who had various infectious diseases. Prior to that, I would have spent most of my time in all the intensive care units, like the recovery room, the surgical intensive care, the high dependency unit, the pediatric intensive care, and the recovery room as well.
Okay, and now let's fast forward to COVID-19, stages 1, 2, and 3. What are your duties now?
Right now, I'm tasked with managing the isolation unit at the Queen Elizabeth Hospital, which caters for the patients who have a diagnosis of COVID-19.
Mm-hmm. And what are your day-to-day functions, duties? I just want to get an understanding of exactly what it is that you do now that you're at the forefront of that battle line.
Right. Apart from directly looking after the patients, some of the patients directly, I also manage a team which consists of registered nurses, nursing assistants, housekeeping staff, and security as well.
Security?
Yes, we do, Carol.
You look after security?
In an indirect way. They come under our management as well.
All right. Now,
because what we're emphasizing at the unit is a team approach. Mm-hmm. So the security, they're included in part of that team approach as well.
Now, I want you to help me to dispel some myths. The isolation unit is just that, correct? Totally isolated as much as possible with very little interaction, physical interaction with the other wards?
Yes, it's a separate and distinct unit from the main hospital building.
And I also would want to assume that apart from the general medical care, Glendora, you and your team are also providing in your own way a lot of therapy, a lot of chin lifting, a lot of rallying cries to hang in there. You're performing that role as well.
Yes, we do, Carol, as in the day-to-day function of looking after patients. The nurses and the medical team especially, we provide a lot of psychosocial support because we see the patient as not just a patient or a number, but a person who has biopsychosocial needs to be looked after.
Now, the families of the patients, do you have any interactions with them as well to offer assurance, again, a lot of hand-holding?
Yes, we do, but we communicate with them via the telephone. I give them updates occasionally as to how the relatives are doing.
Now, preparatory work to be able to effectively manage this isolation unit, what was that like? What was that process like for you and your team?
Well, it's, as I look at it, we're entering into a brand new experience. most of the workers volunteered to enter into this situation. And the great thing about it, we have the hospital and the governmental authorities who have taken care, and they have provided all the necessary equipment and supplies that we need to function at a very high level.
A typical shift, how long in terms of the duration of the shift? How many people on the shift? Are there any protocols for what you do before and immediately after your shifts?
Sure. The length of the shift is 8 hours. Sometimes may work beyond the 8 hours, depending on what the situation is. There are also standard procedures set up to operate during the course of the day. For example, when we come on shift, our preparation starts as soon as we get outside the door. We sanitize our hands. We will go into the unit. We have a routine temperature checks. Everyone who enters will have their temperature checked, coming on duty and leaving on duty. Then we have scrubs to change into. We take the report, and then we will make a plan of care for the patients during the course of the day.
Okay.
After we have completed our assignment, we have provisions to shower. We also get a temperature check as well before we exit to go home.
Okay. Now,
as you would appreciate, Carol, during the course of the day, we would suit up in all of our personal protective equipment.
mm-hmm.
And this is very similar to what you will see in the international media, where the healthcare team are wearing what you guys will call a spacesuit.
Right. Now, not knowing anything about this virus, remember it started off as the novel coronavirus, we understand why. Have you been able to change your attitude, your preconception about it now that you're actually involved in the day-to-day management of care for patients?
Well, as healthcare professionals, we understand some of the risks we are taking when we are looking after patients, not only the coronavirus patients, but the average patient out there. And we approach the situation based on the knowledge that we would have learned while we were training, and knowledge that we would have gained while we were practicing.
Mm-hmm. Now, your shift is finished and you're going home, and it's expected that you are going to live a normal life once your shift is finished. How has that been for you?
For me personally, there have been no problems. My family, they are aware of the role that I play in looking after these patients, and they are pretty confident and supporting of the effort. And they're aware of the role that the government is playing in terms of the safety of all the workers who are involved in this venture.
How do you keep your spirits up as a team? We on the outside cannot begin to imagine how stressful it must be, how daunting. There may even be moments of feeling a little bit overwhelmed. So how do you support each other while you're on duty? And even after?
Yeah, thank you for asking that question. The unit is a small unit. Everything we do, we move in groups of 2. For example, if we're going in to give care to a patient, there's always another person with us, whether it's the doctor or the nurse or the nursing assistant. And we look out for each other, and, in terms of maintaining all the different protocols, we remind each other about the protocols and assist in any way. In terms of keeping our spirits up, we tend to take her outside of the hospital. Say, for example, my hobby, I like landscaping as opposed to gardening, because landscaping is more involved with tools, etc. There are other persons who do gardening, and other hobbies and stuff like that. We also have facilities where we can listen to calming music during the course of the shift, etc.
All right.
So it's more a base system. And so far, it's been working very well.
How has this experience, and I know it is not at its completion, but to date, how has this experience changed you, Glendora, if at all?
My first experience when we were going in, after when we got our first patient, Carol, we were suited up and going in to see the patient. The vision of the firefighters, etc., who were going into those 9/11 towers that fell in New York, it reminded me of how they felt. They didn't feel passionate about going into the building, but they went because they were patriotic and they were extremely committed. When persons were running out of the building, they were going into the building to assist, not knowing what lay on the other side. So those were the sort of sentiments and feelings that we got as we were about to manage the first patient with the COVID-19.
Glendora, I want to...
Sorry.
Go ahead.
Yeah, in terms of changing my attitude, I think it has strengthened not only me, but other members of the team more spiritually.
Excellent.
And socially.
Good. I want to thank you, Glendora, very, very much for taking time out of what is undeniably a very busy schedule. But I also want to thank you on behalf of our team and all of Barbados for the outstanding job that you're doing. And we would want you to convey, one, our sincere gratitude, and two, our best wishes to you and the other members of your team. Thank you very much.
Thank you very much for your very kind sentiments, Carol. Let me also take time to say thank you to the hospital and the Barbadian public and the government as a whole for the role that they have played in managing this situation so far. I also want to thank, there's some groups on Facebook out there, volunteer groups, who are assisting the members of not only the team at the isolation center, but all the other frontline workers who are working in the various isolation centers. They are supporting us in terms of donating fresh fruits and juices and really healthy stuff. We really appreciate their role.
Thank you. Best of luck.
Thank you, Carol. You take care as well.